Hello everybody and welcome to the Tuesday edition of Video Clips, and I'll just start as always with a couple of announcements. First of all, if you live in driving distance of Columbus, Ohio, you definitely want to be here on Saturday, the 23rd of April. We are doing our annual Women's Health Symposium, which features education about hormones and PMS and menstrual cycles and menopause and breast health and mammograms and all the stuff you want to know about. Sorry guys, this one's just not for you. Great lunch, great food, a cooking demonstration, and then we will have appetizers and spa treatments after the learning is over. So it's from 10 to 5. It's an all-day thing here, and we'll have a special meeting for Operation Healthy Girlfriend if you are involved in that effort or would like to be. Second thing, summer semester is, I can't even believe I'm saying this, 6-7 weeks away. The time flies. We're offering, of course, the Diet and Lifestyle Intervention course with our celebrity instructors like Caldwell Esselstyn, Neil Barnard, Ralph Moss, Alan Goldhammer. There's a whole roster of amazing instructors who will teach you. This is great material if you're a lay person. If you're a healthcare professional, you should not be practicing without it, in my opinion. Doctors, nurses, PAs, nurse practitioners, dietitians get CE credit, 39 CEs, and it's done through distance learning. And of course, this can be preparation for a career in a field like what we do here at Wellness Form Health. And if you want to talk to me about this, just send me an email at pampopper@msn.com. We'll set up a time and chat about what your objectives are and see if anything we're doing here can be helpful to you. All right, you might even want to join our provider network, who knows. All right, so I want to talk about, the title of this article that I'm going to talk to you about is Capitalizing on the Fukushima Power Plant Disaster. And there are a lot of lessons to be learned based on what we do here at Wellness Farm Health in this very interesting story. It started in 2011 when a major earthquake followed by a huge tsunami damaged the power supply and cooling mechanism of 3 nuclear reactors at the Fukushima Daiichi nuclear power plant. As a result, nuclear material was released into the atmosphere and became what became the biggest nuclear disaster since Chernobyl in 1986. Well, health authorities predicted that this would result in an unprecedented number of radiation-induced cancers and other diseases. So health authorities in the Fukushima prefecture started examining all people who were under age 18 at the time of the accident for signs of cancer. They were specifically looking for thyroid cancer. The reason why the researchers were interested in doing this was that after the Chernobyl accident, about 5,000 cases of thyroid cancer were diagnosed in children who were exposed to radioactive iodine, and 15 of those children died. Well, the results were reported in August of last year, and it showed that almost half of the 300,000 residents who were examined had thyroid abnormalities like nodules and cysts, and over 100 of them were eventually diagnosed with thyroid cancer. The finding was surprising for several reasons. First of all, the radiation level was much lower. The Japanese government evacuated about 150,000 people really quickly, and many residents there was widespread distribution of iodine tablets to block absorption of the radioactive iodine. Toshihide Tsuda, I always butcher names here, an environmental epidemiologist at Okayama University in Japan, started making presentations at conferences concerning the new epidemic of thyroid disease and cancer among those victims who were exposed, and he published an article reporting that being exposed to radioactive iodine as a result of the nuclear fallout resulted in a 30-fold increase in cancer incidence and over the normal thyroid cancer incidence in children. Well, in response, dozens of children had their thyroids removed, and groups who oppose nuclear power reported that the sick kids were an example of the dangers of nuclear power. Well, here was the problem. Very few of the cases had anything to do with radiation exposure. In fact, from the very beginning, medical authorities suspected that the accident had not caused the abnormal thyroid conditions. Some were insisting from the very beginning that this was the case. According to Dilwyn Williams, a thyroid cancer specialist at the University of Cambridge in the UK, it's most likely that the thyroid cancers that they diagnosed were a result of diagnosis and overscreening, not actually radiation. He says that what the thyroid abnormalities really show is that thyroid carcinomas can begin very early in life. Now, one of the issues was the method of screening. All of the Fukushima residents were examined with advanced ultrasound that detects unnoticeable growths. Now, Gilbert Welch, a medical doctor who's written several books on the topic of overdiagnosis, calls these incidentalomas. The incidence of thyroid cancer in the general population is about 3 in 1 million. In these cases, what happens is basic clinical exams are used when people present in the office with lumps or symptoms. There's no population screening, and certainly no screening with ultrasound, which is much more sensitive. So comparing the Fukushima results with the general population would not actually be valid. Now, to show that the high number of diagnoses was actually due to the screening and not radiation exposure, a group of researchers screened 4,635 children between the ages of 3 and 18 in other faraway areas of Japan. The results were almost the same, indicating a prevalence of 230 cancers per 1 million people. In other words, the incidence of thyroid cancer in Fukushima is really no different than the incidence of thyroid cancer in the general population in Japan, and those people who were not exposed to radiation. The difference was the screening method used. The more sophisticated the screening tool is, the more cancers you're going to find. Diagnosis almost always leads to overtreatment. I've talked about that for many, many years in these broadcasts, and the Fukushima residents were no exception to the rule. Almost all of the people diagnosed with thyroid cancer have had their thyroids removed, in spite of the fact that evidence shows that active surveillance may have been a much better option. It seems that history just repeats itself again and again because the medical profession just does not learn from experience. So going back to 1999, the South Korean government initiated a program to provide ultrasound thyroid screening for during regular healthcare visits for a very small add-on fee. Well, by 2011, the rate of thyroid cancer diagnosis was 15 times the rate in 1993. But the death rate remained the same. So what happened was an epidemic of diagnosis, not screening for early detection, that resulted in a meaningful difference in the death rate. There was no difference in the death rate. The same thing has happened here in the United States. Increases in examinations, imaging, biopsy have resulted in a significant increase in the number of diagnoses of thyroid cancer. Almost 37,000 cases per year right now. In spite of this epidemic of early diagnosis, death rates from thyroid cancer have not changed at all. They've remained constant at about 1,600 per year. So again, we see the epidemic of diagnosis, not early detection, leading to a lower death rate. Well, as a result of this and other studies, the U.S. Preventive Services Task Force recommended against screening for thyroid cancer. This has not cooled the enthusiasm of those who screen, however, because scaring people about thyroid cancer has become profitable, and those who promote early detection and treatment are just not willingly going to give it up. Well, unfortunately, enthusiasm for testing and screening is not limited to thyroid cancer. Mammograms, PSA, and DEXA scans are routine. Genetic testing, along with testing vitamin D levels and screening for conditions like pre-diabetes. It seems like every disease now has a pre attached to it. Get that early, even though the treatment doesn't change anything. These are the norm right now, and they're driven by a lot of factors, including medicines, always fascination with the shiny new thing, and people just jump off the cliff and start doing these things before we really have proof of safety and efficacy. Of course, one of the things that drives it is patients' desire for reassurance via screening that they're okay, and of course, profit. Population screening turns healthy people into sick patients, and it generates profits. Now, what I get aggravated about is that not only is it an unnecessary thing, it really distracts from the things that would actually change people's health, which is diet and lifestyle change. And in addition to the harms that can come from over-screening and over-treatment, you give people a false sense of security. They don't take care of themselves, they maintain terrible habits, and yet a test will tell them they're okay for now. I've spoken about this many times too. People who live their life saying, well, apparently I got away with my habits for another year, so we'll wait next year, get checked again, see if I'm still getting away with the things that I'm doing. So anyway, the reason I focused on this episode today is, and I said, capitalizing. The title of the article is "Capitalizing on the Fukushima Power Plant Disaster." Medicine will always capitalize on any opportunity to turn a whole lot of people into sick patients requiring care. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you Thursday with more news.